Dermal Activator is a wound dressing gel used on various wounds like burn, bedsore, surgical wound, and ulcer. Step 1. If the wound area is not clean, wipe or rinse the wound area with running water. Step 2. Remove the cap and twist the plunger so that you can unlock safety device. Step 3. Push the plunger several times and check if gel is releasing properly. Step 4. Slowly push the plunger and apply slightly wider than the wound. Use 2 to 3 times a day repeatedly until the wound heals completely. In osmotic pressure mechanism, the gel removes harmful substances on the wound area, so it prevents infection, helps wound healing, and eases pain. If it's deep or severe wound, apply the product repeatedly without frequency limit. This syringe type is 1 gram disposable. Remove the cap first and apply the product while pushing the plunger.